complete symptoms of measles. Measles is a highly contagious viral infection that affects the respiratory system. It is caused by the measles virus, which can survive on surfaces for many hours, thus allowing for easy transmission. The virus settles in the mucus of the nose and throat, producing a range of symptoms that begin manifesting about 7 to 12 days after exposure. Here are 8 of the most distinctive symptoms of measles. Fever. Fever is one of the earliest symptoms to make an appearance, and most individuals who contract measles run a temperature. The fever associated with measles can reach as high as 104 F and typically lasts for about a week. If temperature runs high even after 3 to 5 days of taking medication to control it, the risk of further complications is high. Consult with your physician immediately in this circumstance. Cough and coryza. A dry hacking cough and runny nose are classic symptoms of measles. They usually appear alongside the fever and may subside as the fever goes down. A measles patient with extremely frequent coughing spells and persistently runny nose must be kept away from others, as the transmission of virus takes place through contact with infected saliva and mucus. Conjunctivitis. Many measles patients develop conjunctivitis in the early stages of the infection. One or both of their eyes may be unmistakably red, with a watery discharge coming through as well. The affected eye is also likely to be difficult to open after a nap, with the sensation being stuck shut. There is no treatment for conjunctivitis, which typically heals by itself. The only relief comes from using eye drops that reduce the discomfort in the eye. KOPLIK'S spots. A couple of days after other symptoms manifest, white spots, known as KOPLIK'S spots, often appear within the interiors of the patient's mouth. While these help with diagnosis, they are discomforting to the individual suffering from measles. These spots are rather temporary and disappear soon, sometimes going altogether unnoticed. If recognized in the early stages of infection, they allow for accurate, speedy diagnosis, which may prevent spreading of the virus. Skin rash. The measles rash, which is very distinctive, is a flat, red skin discoloration that spreads over time to cover most of the body. It appears several days after the fever, typically beginning at the back of the ears. It soon affects the face and remaining parts of the body, and it usually tends to be itchy. The rash may change color from red to brown before healing fully. Complete disappearance of the rash may take up to 3 weeks. Light sensitivity. As the measles rash grows and worsens with time, the patient becomes painfully sensitive to light. This phenomenon is called photophobia. The patient can find relief by resting in a dimly lit room with no exposure to the sun or any light source. Exposure, even to natural light, requires the patient to wear sunglasses to avoid any sort of irritation or inflammation in the eye. Even in low light, photophobia can cause extreme discomfort and pain in the eye. Malaise. A very telling sign of measles is general malaise. As an initial symptom in the prodromal phase, it can be easily confused with the common cold. Typically, general malaise is accompanied by fatigue, illness, discomfort, weakness and muscle aches. Watery eyes. Red, watery eyes and swollen eyelids are a symptom of measles, especially in young babies and the elderly. Watering eyes can result in blurred vision as well as sticky eyes.